Do men do plastic surgery? And the answer is yes. Statistically, across the country, men maybe make about 10% of the procedures that are performed, but they do. So what are the common areas? If we talk about the male body, essentially what most men are going to ask for would be liposuction. The most common area, abdomen or lower abdomen or love handles. Sometimes men will want to have something done for their chest. You need to determine whether it's gynecomastia, which is actually breast tissue, or if it's just fatty tissue that can be suctioned. So liposuction of the torso is probably the most common body procedure. What about facial procedures? So excluding rhinoplasty, which is probably about 10%, but if we're talking about what does the aging male look for? Probably the most common procedures performed would be eyelid lifts, upper eyelid lift, lower eyelid lift, or both. Following that, maybe something for the neck. And when a person or a man has enough loose skin in the neck and also a visible muscle, then the question comes, do you need to have just a neck lift, or would a facelift be a better procedure? Now, a man who hears the word facelift sometimes just is like, there's no way I'm doing that. But a lot of them will. And so there are other procedures that can be done just for the neck, a neck lift. And if a person or a guy doesn't want to have an incision around his ear, which would be required for a neck lift, there is a procedure that can be done with just incisions beneath the neck. However, you really have to assess the person's skin type, because some skins will heal with less scar than others. And most plastic surgeons, after doing this for many years, can more or less determine if they think the skin is going to heal well enough to basically have a very unnoticeable scar. So for men, eyes, necks, liposuctions of the abdomen and the love handles are the most common procedures.